What you're about to see in the next few minutes will change forever the way you look at the hoof care of your horse. Whether you are a seasoned horseman, a weekend trail rider, into Western performance horses, or dressage, this information will not only assist you in optimizing the efficiency of your horse, but more importantly, be used as a prevention of lameness. If these trimming techniques are properly done, your horse will have more useful days, be free of hoof-related pain, and all with less drugs. If your horse constantly stumbles, is lame or off for 2 or 3 days after being shod, then you need this information. These techniques are not new, not a gimmick, and not a fad. It is a common sense approach to hoof care developed by one man. Gene Ovnicek is internationally recognized as a farrier, clinician, and researcher. With over 40 years of horseshoeing experience and a member of numerous groundbreaking research projects, Gene is looked at as a key contributor to the ongoing advancement of the farrier sciences. His information-packed presentations have been featured at some of the most prestigious farrier and veterinarian conferences in the world. He is widely known for his research data gathered from the wild horse studies he did in 1986 and 87. Gene and his natural balance trimming information has been published in respected equine publications around the world, and he has surprised more than one skeptical veterinarian with the results. Dr. Barbara Page has been a vet and equine surgeon for over 25 years. At the Colorado Equine Clinic, she has treated hundreds of horses with chronic lameness.
I heard Gene Ovnicek speak at a laminitis symposium that I was attending to learn more about the horse's foot. A lot of what he said was new to me, so when I hosted a conference in Denver for veterinarians and farriers, I asked Gene to come be one of the speakers at that conference. I brought some of the lame horses that I've been working on, and he took this lame horse and took her out of a well-shod conventional system of an egg bar and a wedge pad and put her in a shoe that brought the breakover closer to the coffin bone, put the shoe underneath the coffin bone, and this mare went sound and stayed sound. So because I was enthralled with that success with a pretty easy method, I had Gene come back to do another seminar in March of 1995, and again brought many lame horses, and he had very good success with those horses as well. So I went through and studied his reasoning behind what he was doing and what he was doing mechanically with these feet, and I found that his thoughts, which he learned from the wild horses, and the consistency in the feet in those wild horses fit very well with the anatomy and physiology.
Well, I think that with that study, we've first of all been able to see what we think is the optimal model. Not that all of our horses are going to be able to assume that same model, but the fact is that it's given science an opportunity to study the foot in an entirely different way and offer the horse owners at least some hope for soundness in their horses.
Before we delve too deeply into equine foot care, there is some basic equine anatomy that you should be familiar with. Distal phalanx, also known as the third phalanx, P3 or the coffin bone of the equine foot. Medial, this refers to the inside or towards the horse's midline of the limb. Lateral, this refers to the outside or away from the horse's midline of the limb. Medial lateral, this means from the inside to the outside of the hoof or side to side. Anterior, toward the front or front portion of the limb. Posterior, toward the back or rear portion of the limb. Dorsal, this refers to the frontal portion of the hoof or coffin bone. Proximal, this refers to the upper aspect of an anatomical structure. Distal, this refers to the lower end of an anatomical structure generally used when describing the bottom border of the coffin bone. Quarters. In hoof care terminology, this refers to the sides of the hoof wall. If looking at the bottom of a foot, where the center of the toe is at the 12 o'clock position, the quarters would be at the 3 o'clock and the 9 o'clock positions. Toe quarters. Again, looking at the bottom of the foot, the toe quarters would be at the 10 and 2 o'clock position. Heel quarters. The heel quarters would be at the 8 o'clock and 4 o'clock positions. Our first visit is with Tony Harden, a barrel racer.
I go to a lot of futurities, and so I've won some futurities on several different horses, and some rodeos. I have my card, so I go to the rodeos. This mare, we've had trouble with her staying sound and handling bad ground at the rodeos. She's been running barrels since she was 5, started at the futurities, and she's run barrels ever since. Just started getting her legged up and ran her for the first time since then. She didn't stretch out and run. In fact, the further in the run we got, the more that she shortened her stride and didn't run.
What we have here is a beautiful little Palomino mare that's a barrel racing horse, and she has a history of being on and off lame, primarily behind. And she's been barefooted now for some time and is still not doing well. Very short-strided, landing toe first, not only in front but behind as well.
To understand how critical it is for a horse to land heel first, we visit Dr. Gene Ovnicek, who has been a vet since 1964 and specializes in equine lameness.
I wanted to talk a little bit about hoof landing and the different aspects of the bone structure here that we're going to see, or the different effects it has on the bone when a horse lands toe first versus heel first. Okay, basically this is the pastern area here, or the fetlock rather. This is the pastern, and then this would be the coronary band area here, as you can see right along in this area. This is the navicular bone that sits here, and the coffin bone. Well, what happens when a horse lands toe first, and I'll exaggerate here so you can understand maybe a little easier. When this foot lands toe first, all of these bone joints down here hyperextend. In other words, they're going to turn up like this. That puts a lot more stress on the back part of this joint, on the flexor tendon, on the navicular bone area here, and also even causes some stress on the front of this joint here, where you could develop like a ring bone. Versus a horse that lands heel first, which is the way he should land, where we get good frog pressure, is that when he lands like this frog pressure tends to push forward, helps support this joint here, and you don't get the hyperextension effect. A lot also depends on the length of this toe, and many horses today that I see shod have way too much toe, and that again tends to hyperextend this joint, putting more pressure on the navicular bone and the flexor tendon area, and I think is one of the big causes for the development of navicular disease and the navicular syndrome, where you get soreness from the soft tissues in this area.
Heel first landing is important to keep the navicular bone in the proper position, but are there other issues?
It's important for a horse to land heel first for several reasons, actually. Number one, the back of the frog has appropriate receptors in it, so part of the coordination is satisfied by a heel first landing. But most importantly, through the soft tissue in the digital cushion and lateral cartilages, it helps to put the navicular bone in its optimal position in the coffin joint, and it helps to align the phalanges, or the pastern, upon the most crucial phase of their stride, and that's the landing and loading phase.
On every horse, Gene will first find the widest part of the hoof.
I'm going to try to find the widest part here.
After finding the widest part of the hoof, he will then use a marker to map out the foot to determine where the 1/3, 2/3 ratio should be.
Mark that.
The pastern alignment affects the 1/3, 2/3 ratio as you look at the foot from the bottom. As you can see clearly, the distance from the widest part of the foot forward is longer. This is going to have an effect on what we see from our point of view, from a lateral view, you might say. And obviously, there's a lot of hoof distortion involved in that. So that is the key to properly evaluating the foot. If once we realize that from the widest part of the foot forward it's longer, it's going to have a skewed image of the pastern alignment. And you may not have as poorly aligned pastern as you might think, simply because of the hoof distortion. It can be easily evaluated from the bottom of the foot, mapping it out from the widest part, evaluating the amount of distance forward of that and the amount of distance behind that.
Each hoof must be tested to determine where the pain is.
Yeah, there's a little bit of pain right here, but right there. Frog looks pretty good.
Taking a close look at the overall health of the hoof and its various components is of great importance.
This whole quarter in here is all badly bruised. That's just from having this heel non-functional.
Again, after the hoof is cleaned up, Gene will map out the hoof to determine where the ratios are. A shoe is then selected and fine-tuned for a good fit. Impression material will then be mixed and applied to the hoof.
Impression material is a substitute for the dirt that is lacking in a horse's daily life in their foot. And obviously there's a lot of different types out there, and there's a lot of different applications of injectable types and two-part mixtures and things like that. All of those are designed to facilitate for the dirt that's not in the bottom of the foot. And they function very well. They help horses rejuvenate the back part of their foot, help to rejuvenate the frog, overcome contracted heels, and a variety of things. But all in all, it's mere duplication of what's missing, the dirt.
A pad is taped to the bottom of the hoof to hold the impression material until it sets up. During this time, Gene will work on the hind feet. In this instance, Gene has selected a pad, which is then trimmed and secured to the shoe. After the impression material has set up, the temporary pad is removed and the impression material is inspected to ensure that there are no voids. With Tony's barrel horse, Gene decided a frog insert was appropriate, and that was also applied to the shoe. This same system was applied to both front feet, and then new shoes on the hind feet were fitted.
Been able to get her to a good 50% improvement, and I think that's a reasonable expectation for the type of subtle lameness that she's had. And her history's always been short-stridedness, and we could see clearly that she was just hesitating about moving out, and we see a tremendous improvement in that, and we're real pleased with that. Time will tell, but we feel pretty excited about it. She's landing occasionally heel first, and I fully expect that she'll land heel first in another week. And when she does, her stride length will improve and her whole body will feel better. Like anything else, human beings are no different than horses. If we feel real good, then we're likely to excel in our performance. And with what we see here today, I believe that she's feeling a lot better about the way she gets around herself and from going from point A to point B. So I know it's going to have some improvement. This is typical of what we see with performance horses. They feel better, they're just going to do a lot more.
She definitely seems to be striding out longer and a lot more comfortable. Wanted to move out more on her own and seems happier, like wanted to play there on the corner when I turned her, where she's been kind of mopey and you have to drag her along, make her keep going. So she seems like she's already starting to reach a little bit more and wanting to move out freely on her own.
I've been a farrier 20 years, and I was introduced to Gene Ovnicek's work in 1996 by a veterinarian of mine who took me to one of his clinics. And I was taught with the traditional shoeing methods and thought they worked fine. And then I went to Gene's clinic quite skeptical, and after seeing the work and seeing what it did for the horses, really became a convert quickly because I found that all the contradictions that I was constantly running into using traditional methods to try to change hoof distortion and correct lameness problems, those contradictions just went away, and everything became simple, and my horses were happier and sounder, and their hooves were healthier, and I've been a convert ever since and quite a supporter of his system.
I'm hoping that the people who are using these natural trim techniques, they're trying to get the foot so that the horse is using the foot as the way Mother Nature intended. And I think what hopefully they're trying to do is to develop a foot where there's a shorter distance, shorter breakover, and more of the load is being impacted on the back part of the foot.
So how important is the breakover point?
breakover point is only a small part of the equation. The heels have to be considered into this equation. Obviously, the breakover in its most optimal place is going to allow the foot to get off the ground as comfortably as it can. And associated with a properly trimmed heel, the stride length will be at its maximum as well. So it takes two parts of this, not only the breakover, but the way the heels are prepared as well. And one can't function properly without the other. So when you have all of those principles employed, then the optimal performance is expected and generally is attained.
Performance means a lot to cowboys who earn their living with their horses. If their horse is lame, they don't compete.
One of the issues with my good horse M&M that I rode at the 2000 NFR in the calf roping was keeping shoes on him. He has different angled pasterns. Went to Montana, had a guy start shoeing with the natural balance methods and getting him to break over quicker, pulling the shoe back. I felt like he was able to run harder, and I was able to keep him more sound because when he was pulling shoes, he was tearing his foot up every time. And I tried wedge pads and a lot of different things before I actually tried the EDSS system, and it's really worked out well for me. Partnership with a horse is everything. If you're competing on a horse and you're not together with him, you're probably not going to win much. I've got some of the natural balance shoes on him. It's been a big help for his performance, keeping shoes on, and his stride seems to be like he moves better since I've been shoeing him with the natural balance shoes.
On a cold winter day, we visited a horse owner who had seen some movement problems with her champion Halter stallion. Although movement is not judged in halter competition, the owner wanted to maximize the fluidity of her powerful stallion.
We're seeing is a very nice horse that has all of the early symptoms of navicular syndrome. He has a history of being stumbly after about 2 weeks into his shoeing, which is an early warning sign. And he's had a very traditional job of shoeing. We're going to look at the bottom of his foot, divide it up from the widest part forward.
The widest part of his foot, the frog is very long, stretched, which means that it's deformed and pulled forward. The bars want to terminate right about there, and there's the widest part of his foot. I'm just going to draw a line across there.
A healthy frog is one that just looks like a big open flower for the most part. The center part of the frog is intricate in that if there's a deep crease in that frog and it's wide open, then the frog is going to be healthy. If that central region closes, then it is subject to taking on a bacteria that will eventually deteriorate the frog. And also the back part of the frog, the buttress, the very back part, is designed to have a huge callus on it to facilitate for the appropriate reception. There's a ledge that is on the ground surface of the frog that helps to hold the dirt in that commissures and in the back part of that whole hoof. And we've discovered that the dirt is an intricate part of the life cycle of that whole foot.
What we tried to do is basically a 4-point, and I can only have half a foot here, so I can only show you half, but you want most of the weight bearing on the heel and on the frog and on about this part of the foot right here. Actually, very little support or very little sole hoof ground contact should be made with the toe. And that's basically just because we get normal heel growth here. To help support the frog, it shouldn't be any longer than the frog. And one thing I think is really important is when the horse's feet are trimmed, that this frog is not trimmed out and shaped up. You can kind of shape up the crevices here, the sulci along the side of the frog, where you don't get thrush and stuff develop. But basically, most of this frog should be left here because it helps support this navicular bone, and also helps support the whole hoof and maintain correct alignment.
This is where his shoe was ending, right here and here. You don't notice that disparity until you look at where his toe was, and that distance is probably twice the distance as it was to his heel. So this is part of the reason why he's having difficulty, is the ratio of balance from the widest part of the foot forward is greater than it is to the back. That's where his breakover is going to be. There's the widest part of his foot.
Okay.
Through there. And now here's where his heel's going to be. The shoe will extend to this point. So we've changed the ratio from a longer distance in the back to a shorter in the front.
As always, the hoof is tested for pain.
There's a little pain right there.
A two-part impression material is mixed and then applied to the hoof, where a pad is then taped in place until the impression material sets up. A shoe with a pad and frog insert is then nailed in place. After the system is applied to both front feet, it is time to see how he has improved.
This horse has been landing toe first and with a very short stride for a long time, and the discipline that he's been engaged in has not required him to move any different than this. I feel very comfortable with this results. We got a 50% improvement in his length of stride and overall body stride, and certainly have eliminated the stumbling, and he's very much more comfortable. The frog was very atrophied, and we're going to bring that back to life. Nevertheless, we've been able to catch it early by recognizing a toe-first landing, and that's the key to the whole thing. All of the other features of showing signs, the bruising in the heels, the atrophied frog, and all of those things are just other indicators that there's something drastically wrong.
The results I've had are incredible as far as just the difference it made in my work and the horses that I work with. As far as having a horse that comes out being a sound horse. Before it was just like I was just nailing iron on the bottom of their feet. Now I feel like that I'm helping them.
The principles of how the horse is using this foot and what that horse needs to function, supporting of their mass, absorbing concussion when they move, the movement of the tendons and ligaments while they move, and then the flow of blood through that foot. Those four things are the criteria that we think of. What does that foot need? Is it a small foot? Is it a large foot? Is it a draft horse? Is it a jumping horse? Is it a dressage horse? What does that particular foot need for the use designed, and how can I best apply artificially systems that will keep him sound, help him heal, and allow him to do his job.
A month later, we re-x-rayed her feet. He said, I think she's ready for my system. And he came all the way to Creede, Colorado, and put these shoes on this mare. It was the first time she'd been up more than 2 hours for maybe 5 weeks. The second day she was up, she started running in the pasture, and I started riding her a month later. So Gene saved my horse's life in my book.
You know, it's gratifying to know that I've been able to do something for horses that I wasn't able to do before. And the fact is that I don't have all the answers. I do have more than I had 10 years ago. The research is ongoing. We're finding out new information all the time, and I think that's what's important. And there's a lot of people involved in this, too. It's not just the things that I do, it's the people around, people who have the horses, the people who are willing to look at these things objectively, look at some new information, and hopefully get the kind of results that we're getting.
Results. That's what Jan Bigelow wanted and received for her young filly.
We were weaning her at 4 months of age, and she simply got her head caught in the fence and popped back, a simple fall, but happened to fracture her growth plate on the right side.
About 6 months ago, I got called to see what we could do for her, and obviously she had broken her hip and was having to depend solely on the opposite leg for support, and it became deformed and pathological in the joints. And to even complicate it more, she foundered on both front feet. And don't know really why that happened, but the fact is that she now had virtually no leg that was any good. She spent a good share of her time on the ground. So with this information that we've used on less complicated cases, we were able to devise very, just little things for each foot individually, based on some natural concepts that we've learned through natural balance to individually address each foot. The broken hip was one of those, the deformed leg that was a support limb, and of course the 2 front feet, which are foundered. So step by step and piece by piece, we were able to put her together and support her in a manner that she was able to get up and become ambulatory over a period of time. And I don't know if there's any real wisdom in what that's all about. It's just basically a common sense approach of using good, solid information that we got from Mother Nature.
Things change, but she's the best she has been now, and if we can just get her comfortable and enough to be a horse, that's all we're looking for right now, and this is what we need to do. It's just so obvious from what we've done before. This is the path that we need to follow.
Dr. Page has a gelding she wants Gene to look at.
We've just walked this horse up and down, and we've determined that he's landing substantially toe first. And we're going to make some alterations in the shoes, bring his breakover back, maybe use a wedge pad if we have to, but we know it's important to get the back part of his foot on the ground first to accommodate for the appropriate reception, as well as for the alignment of the distal phalanges. Before I go any farther, I'm going to go ahead and just hoof test him to get an idea of where there may be some pain. Start at the lateral heel, work my way around the foot.
Many times during hoof testing, corns are discovered.
Corns in horses' feet are a result of too tall heels. When the hoof becomes deformed and the heel starts to have sharp curves in it, it tends to shut off the circulation to the back of the foot. Corns can be very painful to horses, and that's one of the things that causes them to not want to land on their heels. And the fact is that when the heel becomes diseased, it becomes painful, and then they, regardless of what you do, if you want to shorten the toe up and don't deal with the heel, they still won't land on their heels because it's painful. That's why it's important to deal with both aspects of the hoof balance, the toe and the heel as well.
This is not healthy because, as you can imagine, the angle of this heel running forward like that, and then bearing all of his weight on that, is going to be painful, and that's the reason why these corns are there, is because the circulation is impaired because of the angle of the heels. This is the inside edge of the ridge, the sole callus. So looking at this distance here, we've moved that whole foundation back under him.
After trimming and before shoeing is a good time for evaluation.
And this evaluation right here is a means of determining what I'm going to put on him. He's not landing flat. He's still landing toe first, so that tells me that he's probably going to need a wedge on there to help reinstate some of that angle, but we need to bring that frog back into the picture, so a frog insert is an appropriate thing for this guy.
How can the average horse owner spot problem areas which might lead to future lameness?
Some of the early signs that might lead you to believe your horse is on the road to becoming lame would be simple things like horses that stumble a lot, horses that forge, and horses that interfere occasionally, and but most importantly, horses that land toe first.
After evaluation, the proper size shoe is selected as well as a pad. As before, the natural balance guidelines are followed. Impression material is held in place temporarily with tape. Then the shoe and pad are nailed in place. This is done on both the front feet, and then the gelding is evaluated.
And we've managed to reach our goals in accomplishing a heel-first landing. And we're going to go now to the x-rays, the before and after x-rays, and we hope that we'll see some changes in the phalange alignment because of the heel-first landing, and that's what we normally expect to see.
What we have here are radiographs taken of the front feet before we applied our therapeutic shoeing and after. Left front before, left front after, right front before, right front after. We take our radiographs in a very systematic way every time so that we can get accurate measurements that are repeatable. We measure the up and down position of the bone, the angle or the alignment of the bones to each other, and the position of the navicular bone to the joint capsule attachments of P2. And we look to improve the alignment on these radiographs. Before shoeing, we had 25 degrees on the left front. After shoeing, it was 16, a 9-degree improvement just with shoeing. And the navicular bone improved its position by 2.5 millimeters. On the right front, we have the same thing. The alignment improved by 15 degrees after shoeing, and the navicular bone position again improved by about 2 millimeters.
But there is always the question, should a horse have any off days after being shod or trimmed?
Actually, two categories for that, shod and trimmed. If you're pulling shoes and a horse is expected to go barefooted, then it's not uncommon for them to be a little bit off for a day or two during that transitional period for their foot to adapt to the new environment. However, horses that are routinely sore after being shod, that can present some real issues down the road, and it shouldn't happen. Occasionally, acceptable. Repeatedly, that's unacceptable.
I've seen a lot of horses that have been in a lot of pain become pain-free, and a lot of horses that mean a lot to a lot of people become important parts of their lives for a lot longer times, where they might have considered either passing them on because they couldn't use them anymore or euthanizing them, and it's been a great tool. I couldn't have done it with the tools I had prior to Natural Balance.
He was a hunter jumper. He used to jump like over 3 foot, and then we got him about a year ago. He was showing some lameness when we got him on his left front, and my daughter wanted to just do some low-level jumping, and we had him injected right away, you know, just to kind of give him some flexibility, and that lasted for about 6 months, I guess. But then we noticed that we were having to shoe him every 4 weeks at least. He'd start going off, and then if we didn't do it at 4 weeks, then he was really lame.
The length of time between shoeing periods can be altered using natural balance principles, and every horse is going to be a little bit different in that respect. Those horses, once their foot is brought into proper orientation of the coffin bone, you can expect a horse to go 10, 12 weeks sometimes, and it's not unreasonable to expect that. In the reorganization process, however, 6 to 8 weeks is expected, and once the foot is resumed its normal configuration, longer periods are certainly seen. And a horse came to us with a high ring bone situation, which is questionable as to whether you can get him sound or not. But he also landed very noticeably toe first. And we were able to, with the first shoeing, get him to landing flat some of the time, but still some on the toe. And as typically with a lot of these, they come around as time goes on, and he certainly has. He's improved at least 40%, and we expect him to improve a little more as time goes on. What the future is going to be with the ring bone is what we're going to be able to do with adjustments and exercise and medication and things like that. Those are all things that we'll have to deal with as time goes on. But all in all, we're very pleased with what's happening so far.
Now we're at 4 weeks, and he's not lame at all. I mean, he's a little off, but not anything like he was before. Before, I mean, it was significant. He'd land toe first, and then he was real sore, and he'd drop his shoulder, and you really couldn't do anything with him after about 4 weeks. So it was really kind of hard for her to really advance with her riding with him. We were debating on what we were going to end up having to do with him. We thought maybe we'd have to send him off to a donate him to a rescue or handicap program or something like that, that his days were numbered, but it looks like he's improved significantly and she'll be able to use him again. He was on Cortiflex and he was on isoxaprine, and then we were injecting him with Legend right into the joint. Going to probably be like every 3 months and then go to monthly Legend shots. We've taken him off of isoxaprine completely, and I think we still have him on some Cortiflex. Yeah, we're still giving him some Cortiflex daily just to make him feel good all over. But that's pretty much it. So we're real thrilled that we don't have to go to monthly injections on Legend.
I've been a farrier for 18 years, and I've been using this system since 6 or 8 years now. The change I've seen with the use of these shoes has been less drugs. The horses don't need the same medications, and so they stay in sounder with less.
This is a 9-year-old gelding that has a very mysterious lameness issue. The farrier that's been working on him did a nice job. His feet have been quite well cared for, actually. in the past, and so it's the lameness has continued for some time. So we had X-rays were taken, which rendered nothing significant as far as bone changes in the navicular area, but there was a slight ring bone that blocked out with a PD block, so that's not an issue either. So there's still a lot of mysteries about this horse. He's got 2 feet that don't look the same, which is not uncommon, but the right front foot is the problem one. He certainly lands toe first. He stumbles repeatedly, and these are early warning signs that tell us that something is wrong. And the farrier and the vet who were working on this horse were alerted by these indicators, and so they took some X-rays to help with the proper diagnosis of what might be wrong. We still don't know, and we're going to investigate the situation and just follow the natural balance guidelines to see if we can't sort some things out for this horse.
The other day when we were here and tested his feet, there was some real unusual hoof tests that we got, which tell us something anyway. We did a standard test through the foot here, and all of these are pretty normal. Even through the front part of the bars are pretty good. But the unusual thing is right there. That's really strange. And that's to have that kind of a hoof test. And actually the other day he was a little bit worse. And if you look at this, you'll see this bar where it's curved right there. And this bar is curved here. It's not extreme, but certainly is an issue. And we found that horses that have these abrupt curves in the posterior aspect of the bars will generally have some kind of pain there. So we deal with that by reconstructing the back of the foot. And easy bend. And there's pain through the center of the frog, which is what led them to do the radiographs so that we can get a picture of that navicular bone.
Frog is really nice and healthy. It's very normal. It's not atrophied, and this again is one of the unusual things about this type of lameness is that there's really doesn't look like there's anything wrong. This appears to be the best foot he has on his body, and yet it's the one that's not sound. So those are the issues that are really hard to, through traditional means of diagnostic procedures, really you don't know where you're at with something like this. It's really a difficult thing. So we're just going to follow the guidelines, getting the heels prepared relative to the sole. Again, the 2 painful heels are the areas that I'm concerned with, and if I can deal with that, can get rid of that, possibly the rest of the situation will improve as well. So try to get him to land heel first and eliminate this stumbling thing, and if we can do those little things, maybe we're on the right track to seeing a clear picture. So
You notice here, as I trim that bar down, you see how it's getting straighter and straighter. And ideally what I'm doing is I'm moving the heel that was here back to here. By changing the position of that heel, hopefully the pain will be dissipated as well. Same with this heel here. You see that curve in it? As I bring that heel down, it gets straighter. And the bar and the whole circumference of the foot elongates as well. See that short turned heel actually is now long. Has a lot healthier look. If my breakover is there on my shoe, now from that widest part of the foot, the increased distance back here, I've reversed that 180 degrees. Where before it was here, now it's there. Now it's 180 degrees difference, so.
He's having a lot of pain as we tested with that foot in the center of his frog, and I think that's where he's having the difficulty now. He still doesn't want to load that. And with the shoes and the pads and the adjustable parts, we hope that we're going to be able to isolate that area, unload it, offer the least painful parts of his foot for him to walk on so that he can start landing heel first and eventually reduce all of the inflammation in the foot so that we can create a healing pathway.
Following the natural balance guidelines, the correct size shoe is selected and then it is adjusted to fit.
Bear boy.
The two-part impression material is combined, then applied to the hoof where it is temporarily held in place by a pad taped to the hoof. After the impression material is given enough time to set up, the pad is removed and the impression material inspected for uniformity. The EDSS shoe and pad are then nailed in position. When both front feet are done in this manner, the horse is now ready for evaluation.
Went through the full gamut with this guy and put the system on him, and we took and walked him first, and he seemed improved, although there were still some unquestionable areas, and we put a little frog insert on him, and he seemed to stand on it better, and we trimmed it some after we walked him, and trimmed the front off in the painful area and moved the support to the back, and he seemed more improved with that. Still not landing as nicely heel first as we'd like, so we put a medium rail on him. That didn't seem to help him any. Ground those down to a small rail. We increased the back of the frog support, and none of those things seemed to be appreciable. So what we've done, went right back to our initial adjustment with a very small piece in the back of his frog where he was least painful, and we got him to land slightly heel first, more sporadically. He turns a little better, and now as we've stood him now for a little while and he's walked on that, he's actually loading it more readily. So I think in time, over a period of a week or 10 days, I think he's going to, like so many of them do, just will go out and the inflammation will disappear, the heels will become less painful, and I think that he's on his way to showing us at least where his problems are.
Traditionally, what I've learned through schooling was basically just about opposite what we've done today. In a sense, with a horse that's sore in the heel area or the navicular area, always want to try to elevate it, take as much toe as possible. We've basically done just about the opposite of that today. We've left the toe and took the heel and then built it back up and relieved some of the pressures. I haven't seen an improvement in a sore horse like this with the old traditional method. This I think is probably just in a couple hours here this morning. There's probably more improvement here than the old traditional method would give you, and I'm just kind of generalizing, but a couple weeks time. Like I said, it's totally opposite of what we normally would have been taught to do, but on the other hand, it worked. I mean, what else can I say?
If you have some concerns about what you've seen on the tape, the best first approach should be to get in touch with your farrier and discuss these issues with them. There may not be anything wrong at all, but the fact is that this information is fairly new. The approach of looking at the foot is a little different than what they may be accustomed to. They're a professional person, and you need to rely on them to help you make judgments about your horse's feet in a professional way. And if they find that there's some issues there, then together you can work those things out. And if they need more information, they can give us a call anytime. Or if they need to, get a hold of their veterinarian, show him this tape. And again, it's a matter of just having the proper tools to do the best possible job. And you need a team of people, professionals, to help you with these issues.